Hi, dear friends. Welcome to another topic which explains the facts which we must know about hantavirus, which is a rare but serious zoonotic infection. Hantaviruses are zoonotic viruses that naturally infect rodents and are occasionally transmitted to humans. Infection in people can result in severe illness and often death, although the diseases vary by the type of virus and the geographical location. In the America, hantavirus can cause hantavirus cardiopulmonary syndrome or HCPS, a severe respiratory illness with a case fatality rate up to 50%. In Europe and Asia, hantaviruses can cause hemorrhagic fever with renal syndrome (HFRS). Andes virus, found in South America, is the only one type of hantavirus that is known to spread person to person. This spread usually limited to people who have close contact with the ill person. Let us see the history of hantavirus. It is first discovered following the Korean War. During the war, HFRS was a common ailment in the soldiers stationed near the Handan River. The first hantavirus was isolated in the year 1978 in South Korea and was named the Handan virus. In 1982, the World Health Organization gave HFRS its name, and in 1987, hantaviruses were classified as a distinct genus for the first time. Let us see what are the rodent reservoirs of hantavirus. Key reservoirs include deer mice, vine voles, and cotton rats, which shed the virus via urine droppings and the saliva. In America, the main reservoirs include deer mouse, cotton rat, and rice rat. Whereas in Europe and Asia, the rodent reservoirs include vine vole, yellow-necked mouse, striped field mouse, and Norway rat. How humans get it? They are spread mainly by the rodents. People get hantavirus from contact with rodents like rats and mice, especially when exposed to their urine, droppings, and saliva. It can also spread through a bite or scratch by a rodent, but this is very rare. Hantaviruses, which are present in North, Central, and South America, are known to cause HCPS. The Andes virus is a part of this family and is known to cause limited human-to-human transmission along close and prolonged contacts, primarily in Argentina and Chile. Hantaviruses found in Europe and Asia are known to cause hemorrhagic fever with HFRS. Human-to-human transmission has not been documented in this part of the world. Hantavirus infections are relatively uncommon globally, but are associated with a case fatality rate of less than 1 to 15% in Asia and Europe, and up to 50% in the Americas. Now, let us move on to the signs and symptoms of hantavirus disease. Let us begin with hantavirus pulmonary syndrome or HPS. Symptoms of HPS usually start to show 1 to 8 weeks after the contact with an infected rodent. Early symptoms can include fatigue, fever, muscle aches, especially in the large muscle groups like the thighs, hips, back, and sometimes the shoulders. About half of the HPS patients also experience headaches, dizziness, chills, abdominal problems like nausea, vomiting, diarrhea, and abdominal pain. 4 to 10 days after the initial phase of illness, the late symptoms of HPS appears. These symptoms include coughing and shortness of breath. Patients might experience tightness in their chest, as the lungs fill with fluid. HPS can be deadly. 38% of people who develop respiratory symptoms may die from the disease. Now, let us see what are the symptoms of hemorrhagic fever with renal syndrome or HFRS. Symptoms of HFRS usually develop within 1 to 2 weeks after exposure. In rare cases, they may take up to 8 weeks to develop. Initial symptoms begin suddenly and include intense headaches, back and abdominal pain, fever and chills, nausea, and blurred vision. People may have flushing of the face, inflammation or redness of the eyes, or a rash. Later symptoms can include low BP, lack of blood flow or acute shock, internal bleeding or vascular leakage, and finally acute kidney failure, which can cause severe fluid overload. In HCPS, the disease may progress rapidly to cough, shortness of breath, accumulation of fluid in the lungs, and shock. In HFRS, later stages may include low BP, bleeding disorders, and kidney failure. Early diagnosis of hantavirus infection can be challenging because early symptoms are common with other febrile or respiratory illnesses such as influenza, COVID-19, viral pneumonia, leptospirosis, dengue, or sepsis. A careful patient history is therefore essential, with particular attention to possible rodent exposure, occupational and environmental risk, travel history, and contact with known cases in areas where hantaviruses are present. Laboratory confirmation of hantavirus usually relies on serological testing to detect hantavirus-specific IgM antibodies or rising IgG titers. RT-PCR during the acute phase of illness will be helpful. Remember, there is no licensed specific antiviral treatment or vaccine for hantavirus infection. The care is supportive and focuses on close clinical monitoring and management of respiratory, cardiac, and kidney complications. Early access to intensive care, when clinically indicated, improves outcomes, particularly for patients with hantavirus cardiopulmonary syndrome. There are no vaccines currently available. Preventing hantavirus infection depends primarily on reducing the contacts between people and the rodents. Effective measures include keeping the homes and workplaces clean, sealing openings that allow rodents to enter the buildings, storing food securely, using safe cleaning practices in areas contaminated by rodents, avoiding dry sweeping or vacuuming rodent droppings, dampening of contaminated areas before cleaning, and finally, strengthening hand hygiene practices. Let us see what are the infection prevention and control practices in healthcare settings to prevent hantavirus transmission. Available evidence indicates that the risk of healthcare-associated transmission of hantavirus, including the Andes virus, is very low when appropriate infection prevention and control measures are applied. In healthcare environments, standard precautions should be applied for all the patients, including hand hygiene, environmental cleaning, and safe handling of blood and body fluids. For suspected or confirmed hantavirus infection, use of standard precautions combined with transmission-based precautions during the provision of care is advised. For aerosol generating procedures, airborne precautions should be used. Early recognition of suspected cases, prompt isolation, and consistent adherence to recommended infection prevention and control measures remain essential to protect healthcare personnel. Here are the references for this presentation. which include World Health Organization and CDC. Thank you for your time, attention and commitment to infection prevention and control. See you with another video soon. If you are watching this channel for first time, I request you to kindly subscribe. Thank you.